Hey Telluride community, my name is Alexis Klein and I'm your local health coverage guide with Tri-County Health Network.
And I'm Eric Lang. I too was a health coverage guide with Tri-County Health Network.
So we're currently outside of open enrollment, or the period of time when you can enroll into a health insurance plan. And assuming you have been enrolled into a plan and you've paid your monthly premium, we just want to walk you through what happens if you have to use your plan. Once you sign up for health insurance and pay your monthly premium, or the amount you need to pay each month in order to have the insurance, you will receive a card like this, and you can take it to the doctor's office with you. There are a few important things to know about your plan in case you have to use it.
When signing up for a plan, it is important to choose not only based on the monthly cost of having the plan, but also on the cost of using your health insurance, just in case. So here are a few terms to know and how they help determine what your health insurance can help cover. Premium, the monthly amount paid for the health insurance.
Copayment, or copay for short. This is the amount you pay at the time of a visit to receive services. This amount will range depending on what plan you have or also the care you are seeking. So, for example, you may have a copay for $25 to go to the primary care doctor, or you're going to have a $10 copay for generic medication.
A deductible, the amount you pay in a calendar year for your health services before your health insurance kicks in. So for example, if your plan has a $2,000 annual deductible, you will be expected to pay the first $2,000 towards your health care services. After you reach $2,000, you will then pay coinsurance up until your out-of-pocket maximum.
So speaking of coinsurance is a percent you must pay after you have paid your deductible. So this payment is for covered services only. So for example, your plan might cover 80% of your medical bill after you've hit that deductible. Well, that means that you are responsible for the other 20%. So you pay 20% of the services until you reach your maximum out-of-pocket.
And an out-of-pocket maximum. This is the most you have to pay for covered services in a plan year. After you spend this amount on deductibles, co-payments, and coinsurance, your health plan pays 100% of the costs of covered benefits.
Typically, these apply to all medical services you receive, from having the flu and seeing the doctor, from getting an x-ray on a broken arm. And thanks to the Affordable Care Act, preventive services are free, like shots and standard screenings. We highly recommend you ask your primary care provider what preventive services you should receive. For a full list, check out this link. So this is what is called an explanation of benefits, or an EOB for short. So this is a statement from your health insurance company to covered individuals explaining what medical treatments and or services have been paid for on their behalf. So this EOB is explaining the services Eric received and how much his insurance plan paid for them and what is left over.
So didn't I pay this each month?
You did pay each month, but you paid in the form of a premium payment. So that is the payment you pay to just have health insurance. You may still owe your doctor for services that your insurance company didn't fully cover. And this all depends on the type of plan you have and what services you receive.
So when I went to the doctor, my bill was $500 in total. I had to pay my deductible, which was $250. Then my 20% coinsurance kicked in, which was $50 more at that point. And the insurance covered 80%, which was $200. And then in total, my doctor's visit cost me $300, but the insurance then paid $200, so I saved $200.
You got it. By enrolling in a plan and paying the monthly premium, your medical expenses were mostly covered. But remember, an EOB is not a bill. It is kind of like an itemized receipt. It is recommended that you wait until your medical provider sends you a bill in the mail with the amount on it. Sometimes they may even reduce the amount depending on the service, so it never hurts to wait. You don't owe your insurance company anything outside of a monthly premium, but you may owe your doctor for services that your insurance company did not fully cover.
Let me get this straight. So this final amount is most likely what I owe, since this is my coinsurance amount. But I should wait until I receive a bill from the doctor's office directly in a few weeks and pay them for that.
Correct. We hope that this was informative and will help you better utilize your health insurance.
If you have any more questions, Tri-County Health Network is available to answer them. Give us a call at 970-708-7096.
Thank you.